My name is Khurrum Yusafzai. Today we're going to talk about hyperbaric medicine, and today my guest is Dr. Khurrum Shaukat Yusafzai, and we would like to know more about hyperbaric medicine.
Hi, so I'm Dr. Khurrum Shaukat Yusafzai, Hyperbaric Medical Consultant and founder of Hyperbaric Medical Society of Pakistan. So today I'm going to tell you how to take hyperbaric medicine in Pakistan as well as all over the world. The hyperbaric medicine is a new specialty, and there are not many doctors in America or all over the world. For example, in America, only 1 to 2% doctors know about hyperbaric medicine. So it's a very extremely rare specialty, and to get a consultation from a hyperbaric doctor is very difficult. Therefore, arises the need for online consultation with a hyperbaric doctor, because it's not readily available all over the world. So in order to address this problem, there is wherever there is availability of the hyperbaric doctor, the people who want to get to know about hyperbaric medicine can contact them. So how the hyperbaric treatment starts? The hyperbaric treatment starts through a consultation, just like any other specialty, where the people come to the doctor and they ask for advice. They are examined by the doctor and they will take their history and all the particulars, just like it is done in any other specialty. After that is done, then the doctor writes the hyperbaric prescription based on his clinical assessment. Because the clinical assessment is very important to determine the different parameters of the prescription. I have made a video about the prescription in my channel, which you can see what are the different aspects of the prescription. So I won't go into the details of the prescription. So when the prescription is written, you are then legal to get the treatment. So the treatment is done in two ways. One is through going to a hospital where there is a hyperbaric chamber. If the hyperbaric chamber is not available, then it is done at home. You can buy your own hyperbaric chamber and you can use it. So there are two different types of hyperbaric chamber in the world. One is the diving hyperbaric chamber, which is just like a submarine with portholes, and it's not very comfortable for the normal patients, and the pressures in that chamber is very high. The other is the medical hyperbaric chamber. The pressures in this hyperbaric chamber are subtle. Usually the treatment is done from 0 to 4 atmosphere. Most of the diseases are covered from 0 to 2 to 2.5 atmosphere. So that's fairly very low pressure, and at this pressure not many complications arises, and it's a pretty safe and comfortable affair as compared to the other hyperbaric chamber, which is the diving hyperbaric chamber. Because in the diving hyperbaric chambers, you can simulate the diving depth. Like, for example, the world record for the dive is around 300 meters, which is pretty scary. Like normal scuba diving is done up to 50 meters. So to simulate that, you require very high pressures and very high pressure hyperbaric chamber. Then we have mixed gas chamber, and like the professional hyperbaric chamber where they mix helium, and now hydrogen dives are being conducted. So that kind of chamber is a different ball game. So most of the online literature is concerned about that chamber, the diving chamber, that it is pretty unsafe for people and blah blah blah. This is not the fact in the medical hyperbaric chamber, because the medical hyperbaric chamber is pretty safe. It's just like traveling in the aircraft. Like when you are in the aircraft, it's also like a hyperbaric chamber, because when you're flying at 33,000 feet or 30,000 feet or 20,000 feet, the atmosphere is rare. So in order to make the people comfortable and not liable to pass away because of hypoxia, The aircraft hull is actually a hyperbaric chamber which simulates the pressure which you experience at sea level. So if you are traveling in an airplane, you are actually subjected to the same pressures which the medical hyperbaric chamber can actually provide you. So it's a pretty safe thing. If you have traveled by aeroplane, you can easily go inside a medical hyperbaric chamber because the pressures are not very different. And it's a very safe procedure if performed under the instructions of a doctor. So if you perform it under the instructions of doctor, it's pretty safe. You will not get any side effects or bad effects because the doctor is involved. But if you're taking it on your own, you can end up having oxygen toxicity and a couple of other complications. So it's better to go to a doctor and consult him. The doctor should be a hyperbaric specialist and he should write you a prescription, and the dose of the oxygen in the hyperbaric chamber should be monitored or controlled by that hyperbaric doctor. So that's very important, and that's the importance of the hyperbaric prescription. So if you're lucky to get the doctor, then you go to you should have your luck to find the hyperbaric chamber in the hospital. And to find that is very difficult, especially Pakistan is a very big country by virtue of its population. It's fifth biggest country by virtue of population. So not everywhere you can find hyperbaric chamber. You will find it in the very big cities, and also the chambers are with the military hospitals, which are under the control of the Pakistan military and the defense forces. So to get there is not possible for the common man. So there arises a need of getting your own chamber. Like it also depends on the length of the treatment. Like for example, if your disease is such that you don't require a lot of number of sessions, then you can go and take a treatment in one of those chambers. But if you are suffering from a disease which requires a lot of sessions, like maybe you require it for 6 months or 1 year, or maybe more than 1.5 to 2 years, or maybe forever, like some diseases require maintenance doses where the hyperbaric chamber has to be taken regularly. If you want to know about the diseases, hyperbaric chamber, you can see my video on the diseases, which are actually divided into 14 specialties, and there are more than 300 in number, and they are covered in a textbook of hyperbaric medicine, now currently 7th edition. And there are diseases of the diving which are covered in another textbook called the Textbook of Diving Medicine. So now it is a proper medical specialty with textbooks, with reference books, and also there are increasing number of researches happening all over the world. Like for example, in the medical universities, these researches are coming into online database of the because the hyperbaric specialty has its own online database of research articles. So when you go through the research articles, these are the new researches, and after peer reviewed and scientifically assessed, they come into the textbook of hyperbaric medicine, just like any other specialty like surgery, medicine, or whatever. So the interest in hyperbaric medicine has increased, and because of this, now people are turning increasingly towards hyperbaric medicine. So it treats the disease, and it also treats. It's also good for cosmetic purposes like health and beauty and anti-aging, and it also is helpful in improving the nerves function like neuropathies, and also improving the quality of life, like people who were old, like senile, their brain shrinks because of brain atrophy, because of the age, and they start forgetting things. Some also end up with diseases like Alzheimer's. So hyperbaric chamber medicine has proved to help these people. So it's about time, like the people who are watching this video should consult me if they are having certain disease for which there are no options, because hyperbaric is involved in all these diseases because it's a healing technology. It heals the people. So people would be confused that how come it's treating so many disease by a simple procedure. The reason is this: because it's a healing technology, and the healing is required in every disease or pathology which occurs. If there is a disease, the underlying healing is also same. So how hyperbaric do this? You can see my mechanism of action video where I have described what is the mechanism of action of this hyperbaric medicine, how it heals. For example, the stem cells are increased in your own body by 15 times, and your immune system is 300% more potent and powerful, and the edema is removed in the body. The edema is sometimes causing the blood supply to get hampered because of the injury, inflammation, or certain. So it will heal the inflammation very quickly. It has been found to be more potent than the steroids, and many diseases where the inflammatory process is a big problem, and the steroids and other anti-inflammatory drugs have been found to be problematic with side effects. The hyperbaric chamber has helped them a lot, like ulcerative colitis, the Crohn's disease. Uh, the people have benefited a lot. So it's about time that you contact your hyperbaric doctor or come to me and take advice. I will be gladly able to help you with the prescription. So after the prescription, then comes the question of how to go and take the treatment. One, as I described, is to go to a nearest hospital where there is a chamber. If there is no chamber, then unfortunately, if you live in a place, you have to buy your own chamber. And there are different types of chamber. I have a video on my channel on the different types of hyperbaric chamber. So there are chamber for the home use, there are chamber for the clinic use, and there are chambers for the hospital use, which I have divided among the medical grade hyperbaric chamber. So the one for the home is actually health and beauty hyperbaric chamber. They are a little different, and they are actually lightweight, and they are made up of special material, and they don't go more than 1.5 atmosphere max. They operate at 1.3 in most of the countries. So these chambers, although are not proper hyperbaric chamber, but they do the job. And it's the job of the hyperbaric doctor to give you prescription depending on what kind of hyperbaric chamber is available to you. That's very important. That's the reason I'm emphasizing a lot on consultation with the hyperbaric doctor, because he can actually calculate the amount of oxygen in your body. There are actually tables. The diving community use tables, and these tables are calculated on the base of those formulas. So when you take treatment, the hyperbaric doctor is a trained deep sea diver, and he has done training in the submarines and the deep sea diving. Most of them are ex-military officers, because normal doctors, who claim that they are hyperbaric consultants, is entirely not correct, because you cannot be a proper hyperbaric doctor without your background in deep sea diving and your experience in the diving medicine, because that's half of the hyperbaric medicine. And if you are an ex-military officer who has done special services, or who have trained in the deep sea diving, they know how to calculate the oxygen inside the body, and they can calculate how much sessions will cause oxygen toxicity. Because if you do oxygen toxicity, you can damage yourself, and that damage cannot be rectified, because there is no cure of oxygen toxicity. So it's advised and very important to consult the hyperbaric doctor. He will charge a fee, and after the fee, he will write the prescription. After the prescription, you can safely take. And while you're taking the treatment, you can go to that doctor and also consult him for day-to-day matters or complications arising from this. So it's pretty interesting, and I hope today's talk would have answered this question from your side.
For sure. So, is hyperbaric treatment safe?
Yes, that's a very good question, and that's a very common question everybody is asking. That is hyperbaric treatment safe? Of course, it's safer than the aspirin. And just like any drug you're taking, there are good effects and there are bad effects. Similar is the case with hyperbaric medicine, but mostly, at the pressures we operate for the diseases, it's very, very safe. But still, in order to not overdo, like some zealous people, they have bought chambers, and most of the chambers are not operated by doctors. They are operated by technicians or nurses, especially in America and some European countries. They don't know the physiology, the pathology, the biochemistry behind the diving medicine or the hyperbaric medicine or the oxygen toxic. They don't know how to calculate the oxygen loading depending on how much the pressure is, because the inside the body, the oxygen actually dissolves inside the water of the body, and since human body is 70% water, so the actual loading of oxygen happens inside that water, interstitial spaces. So it's not going inside the blood as people think that, okay, we will measure it through some oximeter or something, which is really not the scientific way, because how much oxygen goes inside the body is directly proportional to the pressure, and it's determined by the Henry's law and the gas equations. So, and then another thing the people should understand: the healing or whatever good effect occurs is not inside the chamber, it's actually occurring outside the chamber. Like when you take a 1 hour session, the good effects happen all the day. So you take 1 hour every day, and we have actually standardized 1 hour treatment. Now we take 60 minutes, so 15 minutes to go inside and attain the pressure, and 15 minutes after. So that's actually a 90 minutes affair, but actual treatment session is for 60 minutes. And this has been standardized, and the pressures and the number of sessions is actually changed by the doctor depending on your disease. Yes. So I hope I have answered your question.
Yeah. So, where in Pakistan these treatments are being taken?
In Pakistan, unfortunately, only the military. There are two places. One is in Islamabad, and another is in Karachi. The Karachi one is not open to the general public, and in both places there are no hyperbaric doctor posted there. So, in order to take the treatment, a prescription of a hyperbaric doctor is needed for for performing hyperbaric operation. So, for people of Pakistan, it's advised that you have to buy your own chamber if you can afford it, and you can contact me. It can be arranged. In some other countries, there is facility of renting the hyperbaric chamber for your home use. So I hope I would be able to provide that for the patient, but right now we don't have the facility for renting, only the facility for buying the hyperbaric chamber for home use. And there are hyperbaric doctors in Pakistan, but there are not too many available so far.
So, what are the requirements for writing the prescription?
Yes, the requirements for writing the prescription is same as for any other specialty, that when you contact the hyperbaric medical specialist or consultant, you should have your medical, like investigations which have been performed by the other medical specialist ready. So you can provide him with the blood tests, the MRIs, the CT scans, or all the investigations. The record you should have. You should have your own file. So you should provide him with that so that he can assess you just like any other doctor. Then maybe he will prescribe you some other investigations if they are not present in the one you have provided. And then he maybe he will refer you to any other specialist like medical, surgical, ENT, or eye, depending on the nature of your disease. After he refer you to that doctor and you take advice from that, then together he will make an opinion based on your investigations and tests and the like he will make a scientific record, and he will create a big file, and with the file he will also give you instructions on how to take the hyperbaric treatment, like do's and don'ts, and a big file he will also give you along with the prescription.
So thank you very much for Dr. Khurrum Yusafzai for giving us such a nice podcast about the hyperbaric medicine. And I hope you subscribe to our channel at Ksybiz and like our video and also comment about your opinions about it. So thank you very much and goodbye.